Coming of Age is coming up next. I'm your host, Josh Newby. First today, we'll discuss risk factors and prevention of colon cancer. As we approach National Colorectal Cancer Awareness Month, we're speaking with Baptist Healthcare about this often misunderstood disease and the best preventative measures you can take to help ensure good colon health. We'll also talk dementia and memory loss disorders and the resources available to help caregivers and patients dealing with this troubling affliction. Lastly, we'll be talking to United Way about an important program that helps eligible community members get the help they need to prepare and file their taxes. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. In February 2000, President Clinton officially dedicated March as National Colon Cancer Awareness Month. Colon cancer is the leading cause of cancer deaths in the United States for both men and women. Many colorectal cancers can be prevented or detected early when they are easier to treat. That's why screenings are so important. And here to talk to us today about why people get colon cancer, how it can be detected, and what treatments are available is Dr. David Dozer, a gastroenterologist from the Baptist Medical Group Gastroenterology Office. Thank you, Dr. Dozer, for taking time out of your day to be with us. I've heard that colorectal cancer is one of the most dangerous types of cancer. So explain to us exactly what is colon cancer and how is that different from other types of cancer?
Yes, thank you. Thank you for the opportunity. Colon cancer is the third most common cause of cancer in men and women and the second leading cause of death. It starts out 95% of the time as a growth in the mucosa. We call those polyps. And those can grow over the course of 5 to 15 years and turn into cancer. Only about 5% of polyps turn into cancer, but when we screen patients, we take them out. So we take away that risk.
Why do people get colon cancer? Are there risk factors you can control, or is the cancer mainly hereditary?
That's a good question. There are risk factors. There are definite risk factors, some that we cannot control, such as our family history or a history of polyps. Ulcerative colitis patients have a higher risk. And then there are risks that we can control. We call them modifiable risks. Obesity is one of the big ones, physical inactivity, increased amounts of processed foods and red meats, smoking, alcohol use, usually the same things that lead to worsening cardiovascular disease also lead to worsening colon cancer. So those things we can change, and that would make a big impact. But the biggest thing, risk factor to colon cancer is not getting screened.
As with most diseases, I'm sure the key to surviving and beating colorectal cancer is to catch it early. What are the signs and symptoms that people should be aware of?
That's a good question. That's probably one of the questions that I get asked the most when I have a patient in front of me. And I tell them honestly, the most common symptom of colon cancer is you're feeling great. You're feeling fine. There are no symptoms. That's the bad thing. And that's what separates this cancer out from the other ones is frequently it occurs, develops, and spreads before we know it. But other things that we have to be concerned about would be rectal bleeding, abdominal pain, change in bowel habits, unexplained weight loss, iron deficiency anemia. These are all signs we should start thinking about either large polyps or colon cancer.
And what tests are available to detect this cancer? I've seen commercials about Cologuard where you can take the test at home. Would you recommend this? What's your general advice on testing?
Well, the gold standard for colon cancer prevention is colonoscopy and polyp detection and removal. If everyone came in at the appropriate age, we could really wipe out about a third of cancer deaths in the country if everyone would have their screening. So screening colonoscopy is the gold standard. Cologuard is a stool DNA test. Yes, you can do it at home. You don't have to prep for it. but it only detects about 40% of large colon polyps. Now, it'll detect 95% of colon cancer, but we want to prevent cancer. That's the whole goal. We don't want to wait until they have it. So Cologuard is for people that are average risk. Let's say someone says they'll never have a colonoscopy, or let's say somebody says that we know that somebody's too sick to have it. They have bad heart disease or lung disease, they'd be at a higher risk. Then I think a Cologuard is acceptable. But the average risk person coming in for a screening procedure really should have a colonoscopy.
I've heard that there are 5 stages of colorectal cancer. Can you explain what that means and maybe go through each stage briefly?
Well, that's correct. There are stages, and the mortality, the ability to survive the disease depends on what stage you are. Now, the first stage is stage 0, which is what makes my day. People ask me, why do you do this every day? It's because if I take a polyp out and there's cancer in the polyp, that patient is cured. Okay, that's stage 0. And then every other stage, it has to do whether the cancer has already spread to the colon, through the colon, the lymph nodes, or distant organs. That would be stage 4, which would have the worst prognosis.
What would you say are the best tips to preventing colon cancer? You mentioned earlier that that was key.
Well, that's a good question. The best tip is just to be screened. That's the best thing, to come in for screening. A lot of people have fear of the procedure and everybody is sedated. You don't feel a thing. The prep is the worst part, but that's not I tell patients I'd rather do a colon prep every 10 years than chemotherapy. So come in and get screened is really, really important. And we see a lot of younger people now with the disease. So last year or the year before, the American Cancer Society changed the screening age to 45 for most people. African Americans, our patients come in at age 40. They're at a slightly higher risk. So we're screening earlier nowadays to pick up the lesions before they turn into cancer. So you've got to get screened.
Great information. If someone is interested in getting in touch with you, we have your number on the screen. Are you accepting new patients? Can they call you directly? Do they need a referral from their primary? How does that work?
Yeah, most often we don't need referrals. Sometimes it's insurance-based, but most often patients contact our office, we get them in. We have many very talented nurse practitioners and PAs that will be more than happy to see patients as well. The physicians in our group also see patients, and that's a good way to get into the system. A simple phone call and we'll get you in. And oftentimes patients don't even have to come into the office. We can do a health screen over the phone and get them scheduled. So we make it as easy as possible because we want everybody to come in at the appropriate time.
Excellent. Thank you again. Coming up next, the early warning signs of dementia and local resources for care and support. Stay with us.
Transform your bathtub into a walk-in shower with TubCut.
It's the greatest relief in the world, being able to feel safe in the bathroom again.
TubCut installs in 1 day, is 100% reversible, and has a lifetime factory warranty.
I had shopped around because money is an issue, and I found that the TubCut was the most affordable choice.
Get affordable, safe, and easy step-through access to your shower.
Call TubCut at 850-529-7601.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference. The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, 1-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
For many seniors and caregivers, dementia, or loss of cognitive functioning, is a looming concern. For seniors dealing with memory loss or similar symptoms, asking for help may be a challenge. And for caregivers, changes in personality and brain function of a loved one can lead to conflict and pain. Ellie Enriquez is here to talk to us about this issue and how to approach diagnosis and care planning for this complicated topic. Ellie, thank you so much for coming on today.
Thank you for having me.
I know you are from the Memory Disorder Clinic. Tell us about everything you guys do over there.
Sure. So exactly what it sounds like. We assess and diagnose individuals with memory issues, and that can range from Alzheimer's to dementia with Lewy bodies, even Parkinson's disease, things like that. So we see people who have any kind of memory concern. I actually just had a patient yesterday. Doesn't look like they're going to have any form of dementia or any diagnosis, but just stress, lack of sleep has caused difficulty with remembering.
Sure.
So they came in. We do a full diagnostic assessment. So that's part of my responsibility is I meet our new patients. I do the intake assessments, get a history, their background,
Sure.
you know, what type of work did they do, education, mental health history. And then Dr. Gore, he will come in and he does a physical assessment. And depending on what we've gathered so far, he will then order an MRI, an EEG, basic lab workup, and then usually neuropsychological testing. And so that gives him the full picture of what could be potentially causing this person's memory issues, and then what's going to be the best course of treatment for them.
Okay. You mentioned that initial assessment, that, you know, that sort of screening process. Tell us about what that looks like. What are you looking for in that initial assessment?
Sure. So I mentioned the history.
Sure.
So asking questions, you know, about type of work that they did. So just getting an idea of where the cognitive functioning was prior to memory issues, and also seeing what that person is able to recall, building rapport with them.
Yeah.
And then the next part is we go through a series of checklists, and they're kind of categorized based on different types of dementia. So it's letting us know what type of behaviors and symptoms, where that correlates in the brain. So that's giving my doctor a better idea as far as testing what he could potentially be looking for or what we're potentially looking at.
Okay. I know that, you know, testing and diagnosis is the big part of what you guys do over there, but I'm curious, what other resources do you offer to the community in terms of dementia?
Yeah, so another part of my responsibility is the education and, of course, as a social worker, linking people with services and resources in the community. So part of our standard process, once we've gone through diagnosis, then we jump into education. So educating on things like delirium, the progression of the disease, and doing care planning. So ensuring that they have a power of attorney or advance directive, things like that. And, you know, what is the backup plan if something were to happen to your caregiver? So helping them plan and prepare for the future.
Okay. I know that we run into this a lot at Council on Aging. You know, as you age, your memory isn't as great, right? For whatever reason. I don't think that's a secret by any means. But there's a line, right, where it crosses from your typical, you know, oh, you know, you forgot to take your medicine, or, you know, you forgot an appointment, to it's starting to impact your daily life, your activities of daily living. Where does the Memory Disorder Clinic sort of draw that line in terms of everyday forgetfulness and, okay, you know, we need to look at what's happening here?
Yeah, I guess really, I guess I would go back down to that checklist sheet that I mentioned, because we've met individuals that they end up getting a diagnosis of Alzheimer's, but they're still doing okay in their activities of daily living.
Sure.
They may just need more reminders, so appointments, for example. So maybe they're still dressing themselves, grooming themselves, they're still driving, they're not getting lost, they're not forgetting where they're going, but maybe paying bills is a little frustrating, and they've missed a payment, or they've made a double payment. Or another example would be confusion in the kitchen, so operating the microwave or forgetting steps to a recipe.
Okay.
Things like that.
Makes sense. I know you mentioned earlier that you offer counseling and support to caregivers as well. And I know a lot of caregivers who are in denial that their loved one is, going through the stages of dementia. What advice do you have to caregivers in terms of having that conversation with their loved one?
Sure. It's definitely a hard conversation.
Yeah.
Understandably. I think, my best advice would be to approach it with love and compassion, and just understanding that I think what we see with a lot of patients and their caregivers or anyone that comes in, there's this stigma with dementia and especially Alzheimer's that, this is it.
Yeah.
You're going to have all your forms of independence taken away from you, and that's not what we're here to do. There is no cure for dementia, but what we can do is help treat those symptoms and help that person, their family, plan and prepare for the future. And really that's where we've seen the most success. So I think approaching it again with just love, compassion, and letting that person know that, hey, these are some of the changes that you've seen, because 9 times out of 10, they've already seen it, and they're trying to overcompensate for it. And they really just need to be validated and feel that love and support.
Okay. Last question for you. There's still so much that we don't know about dementia, right, and Alzheimer's. Any new research and anything happening on that front that maybe our audience could benefit from?
What I know right now, I was actually just looking up this morning, just different research opportunities that we could get involved in as the clinic. And a lot of what I've been seeing is person-centered care, which that's something that we focus on as social workers. You put the person in the center of whatever it is you're doing. So checking in with them, letting them know, and this is something we do at our clinic, is we let them know what testing, what the plan is, and then we ask, are you interested in these things? What is your goal? What do you want to take away from this? So I've been seeing a lot more research where they're focusing on like art therapy or music therapy, but again, centering it around the client.
Bringing it back to the person. I love that. Ellie, thank you so much for coming on today.
Yeah,
Appreciate
thank you for having me, Josh.
Absolutely. Next up, tax season is upon us, and United Way is helping the community with free tax preparation assistance. Stay with us.
Over 2 decades ago, TLC Caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics, from a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC Caregivers.
I'll never forget the day our landlord called and said, "Read your lease. No pets allowed." My owner tells him my dog ate the lease, but that didn't work. And now I'm stuck in a shelter. But this pit bull is ready for a new crib. I'm loving, loyal, and play well with others. So don't be intimidated by all my muscles, because the biggest one I have is my heart. That's right, I said it.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
Tax season is well underway, and for those that may need help with preparation and filing, United Way of West Florida is here to assist. The Volunteer Income Tax Assistance Program allows eligible families or individuals to get free tax preparation services. We're talking to Mary Zaladonis and Elizabeth Bondurant from United Way to get the details about this important community offering. Thank you both so much for coming on today.
Thanks for having us.
Appreciate you. To get started, tell us what Vita is. Tell us who's eligible to receive it.
Okay, so as you said, Vita stands for Volunteer Income Tax Assistance, and it's a program that is sponsored by the IRS, which connects people who qualify to volunteers who go through a rigorous training program to have their taxes done.
Okay. I know the dates have been a little wonky recently with the pandemic, the past couple years. What are the important dates that people need to know for this year as far as this program goes?
Certainly. So this year we are offering an in-person and virtual component to Vita, and we're covering Escambia and Santa Rosa counties with 4 different sites that will take place on different days of the week, starting February 7th and ending on April 18th. And so anyone that wants to make appointments for that, they're able to call 211, which is our information referral service. And we have the specialists on the line to be able to screen the callers. And the eligibility for it is, for the in-person appointments would be elderly, disabled, and individuals who have technology challenges. They might not have Wi-Fi or the ability to prepare their taxes on their own. But we are offering this year in-person and virtual options.
Tell us about the volunteers that you have basically facilitating this program, because it's, it's your taxes, it's your finances. You don't want just anyone, managing that.
Sure. So all of our volunteers, which I'm just amazed at their dedication, because they clearly have to go through an IRS certified process, and begins with the standard code of conduct, which ensures that everything is confidential, that it's going to be done with quality work and held to the highest level of service. And from the standards code of conduct, then it rolls into a screening and intake process that each volunteer will complete with a client coming into service. And then there's a basic, advanced military and international certification, and all of this is facilitated through the IRS. They could easily, any volunteers want to reach out to us and we could get them connected for it. Then there's also the site coordinator. So each of our locations, our 4 locations, has a site coordinator volunteer that's kind of working between the site and us and Elizabeth to make sure everything is okay and connected. So we are monitored. They come in to review things, to make sure everything is up to the IRS standard.
Good. So talk about the impact that this free service has on the community. Because I'll be honest, up until a couple of years ago, I didn't know that this existed, and I imagine a lot of seniors especially probably don't know that this service is available to them. So talk about that impact that it has on those, maybe more vulnerable populations.
Certainly. Well, first of all, it's amazing how it's been around for a while and we still don't know about it. Elizabeth and I were talking about that, that this has been in the community. So the last couple of years have been unique because it has been virtual and limited in person because of COVID. So I do have some stats. For the 2021 tax year, it was all completed virtually. And so the economic impact payments totaled over $189,000.
Oh, wow.
So that was saved here in the community, given for the taxpayer, and they were able to roll that back into our community, which had a $1.25 million impact in the community. So the importance is that this is a free service and is certified through the IRS, and it is putting money back into our community and into the pockets to the people that need it, because it is assisting those that are low to moderate income tax filers. So we want to continue to help them.
Definitely. And speaking of some of those seniors, talk about what are some of the unique tax preparation needs of that population?
So some of the feedback that we've gotten from our seniors is that they really appreciate being able to sit down with a person who is able to make a connection with them. They appreciate the level of training that our volunteers have, and sometimes they have indicated that they have those barriers. They either don't own a computer, they don't have Wi-Fi, and so whenever it kind of brings back the familiarity of face-to-face, and it blends it with the technology that we use so often today.
Okay. How does someone make an appointment? I know you mentioned that they could call 211, but is an appointment necessary? Can they just walk in? How does all that work?
So we do prefer them to call 211.
Okay.
It's well known in the community, our
Sure.
information and referral line. And just whenever you call the number, it's option number 9 for our Vita tax assistance. And all of our in-person appointments are going to be held with appointment only.
Okay. Last question for you. We mentioned this a little bit earlier, that obviously tax documentation and filing your taxes is a very sensitive issue. What type of assurance do you offer that the taxes are actually being filed correctly and the IRS isn't going to, come back and audit them or something like that?
Sure.
Right. So, as we mentioned, all of our volunteers go through rigorous training. They have to earn certifications depending on what level of certification they would like to receive.
Okay.
And that goes all the way up from basic to international. And then all of our sites are overseen by a site coordinator who is trained in all of those points. Well, one point that I really appreciate about the process is that every single review that comes through goes through what we call the quality review process. And even though a volunteer is highly trained, all of us can miss something. So any return that comes through is going to be looked at by 2 sets of eyes. 2 people are going to look at it and make sure that it is high quality.
Okay, awesome. Definitely very reassuring and very timely information. Thank you, ladies, both for coming on today.
Thanks.
I appreciate
Thank you for having us.
Until next time, enjoy life. You've earned it. This will be my last coming of age with you all, not because the show is going away, but because I am moving on to a new opportunity within the agency. I want to thank you for welcoming me into your home these past 5 years to talk about senior issues, local events, political happenings, everything that we've discussed. I want to thank the Blab staff here for being wonderful to work with, always accommodating my schedule and the schedule of my guests. But the show is not going anywhere, I promise you. My successor, Emily Echeverria, is the new Marketing Communications Director at Council on Aging of West Florida, and I know she's going to do a wonderful job bringing on interesting and engaging guests. I hope that you will welcome her into your home as you've welcomed me into your home. Again, it's been a great pleasure. I'm not going anywhere. I'm staying at Council on Aging of West Florida. Thank you all so much for your time and your support and your dedication to senior issues in Escambia and Santa Rosa counties. Goodbye.